I don't know if these like conspiracy theories or the crazy things people are saying are new as much as they're things that would have stayed private prior to social media.
Exactly.
Like some people just don't have a filter anymore.
Right.
Or like just don't think that the words that they put out on social media can have consequences, as we've seen through the number of people who say dumb things and get fired.
Yep.
And like, wow, I didn't know that was going to happen. Like you put your name and your real picture next to some racist stuff, and then you are surprised that they were able to find your job and get you fired. And I'm Spencer.
And as you might already know, May is Mental Health Awareness Month. And a big part of our regular podcast is segments where we talk about self-care and the importance of that and taking care of your mental health. So we wanted to bring someone in to have a discussion about what we can do to just make sure we're taking care of ourselves and checking in with our mental health, especially at such a stressful time as now, dealing with the pandemic. So today, we're going to be speaking with Kristina Lauderback, who is a licensed clinical social worker. She has over 15 years of experience working with individuals, families, and children, and she has vast experience working in medical settings, including hospitals and psychiatric facilities. So welcome, Kristina.
Thank you.
So I guess to start us off, just what are some things you're seeing as far as mental health and the impacts of the COVID-19 pandemic?
So currently I'm working in a boys residential facility. And some of the time that they get there is free time. And so we typically will take them off campus and, do activities with them. But since COVID, we've had to greatly reduce that. So in a lot of sense, where you're trying to support kids that have poor impulse control, high anxiety, maybe a bit of oppositional defiant disorder. They may have ADHD. Some of them may have come from the local juvenile facility where they've been locked up in a cell and their free time consists of a courtyard, some basketball hoops, etc. Coming to our program, there's a little more freedom for them. But since COVID, we have not been able to take them out on our routine scheduled outings. A lot of their privileges are based on outings, depending on what their goals are and how well they do in our program. Lots of times we'll be able to take them off campus, maybe run them to the store. There's a segment of our program where it's called C shopping. So everybody that's at a certain level, it's a tier level C, they get the opportunity to go out and shop. And so we've really had to adjust our schedule, support them in adjusting their feelings and emotions and moods around not being able to do that. So, you can imagine that it's been very difficult for them. They're, high energy kids, and they've worked hard to get to the levels in which they're at. And unfortunately, they don't get the same privileges that they typically would get. So that's been pretty difficult. So yeah. That's
so along with those kids, like, I guess a lot of us are stuck in the house. Like, what kind of like impact does that have on mental health in general? Like, just not being able to go out and do those things.
I mean, it has a lot. Think about how you've felt, being in the house. What's it been like for you and Spencer, for two individuals that don't necessarily have the same kind of mental health illnesses, but you can feel the impact of being stir crazy and isolative, and not being able to go out and connect with people. Human connection is huge in mental health. Being able to connect to people, see people, talk to people, touch people. These are all really important pieces in our everyday regular mental health. So when you have people that are struggling from obsessive compulsive disorder or anxiety disorders, or people who are struggling with depression and some of their goals are to get up and out of the house, or when you see people with certain phobias like agoraphobia, where a goal might be to get out of the house once a week. I mean, this pandemic is greatly impacting these mental health disorders. It's not only creating added stress and anxiety and frustration, it's keeping people very isolative. People are afraid of the unknown. And so I would say people who are struggling with mental health, it's much more heightened for them than someone who is able to emotionally regulate.
So how, I guess, like, this brings up a question of like, what's going on with this pandemic, can this affect someone who's felt like in general they haven't had any major mental health issues or diagnosis before? Like, so this can impact people?
It can create a lot of anxiety. So when you think about people who have, in some respects, maybe just flew low under the radar, where mental health illness maybe hasn't been a predominant issue in their life. And in some cases, a pandemic like this could trigger it. And just from the stress and anxiety alone, and the fear of unknown, it can really trigger some undiagnosed or non-predominant mental illnesses. Absolutely.
So how, like, I guess, what might be some symptoms or signs that, hey, maybe I'm not doing as well as I thought I was doing?
Well, typically you can tell when your anxiety is heightened. Lots of times it resorts to panic attacks, shortness of breath. I
get like the like jumbled thoughts. Like,
ruminating thoughts. Right. Ruminating thoughts, a lot of negative thoughts. Sometimes filtering and negativity comes involved with that. And just the fear of what's next. And not being able to. So routine is a very important part of human life. Lots of people really depend on their day-to-day routine to get through their days. And when that routine is disrupted, it can create a lot of undue stress, which then leads to, mental health struggles. It also leads to, comorbidities such as physical ailments, gaining weight, lack of exercise, lack of sunlight. And then it can create heart issues, panic attacks, stroke. Some of the leading causes of stroke, diabetes, heart attack, hypertension is stress, right?
Yeah, I think a lot of people don't realize that.
Right.
I think a lot of folks don't realize how the body captures those things that are in your mind or in your feelings, that it holds it in certain places.
Right. And so, if you're somebody that's used to getting up, maybe exercising or not, but just getting out of the house, feeling the sun on your face, then, coming across this pandemic where, oh my God, I can't go outside because what if it's carrying in the air and I don't want to, catch this illness. It really throws somebody off and creates a lot of undue stress in their life, 100%.
Yeah.
So what kind of things, like, as this goes on, because we, it's not over yet, but I guess what kind of, and I'm just picking your brain here, but what kind of like feelings might we expect, like, as time goes on, as
Yeah.
because it's a good chance. I've been with some of the work I've been doing, I've been talking to some nonprofit organizations that provide direct services, like such as summer camp for youth. And a lot of that's not happening, especially in our state of Pennsylvania.
Right.
So, it could be that as time goes on, maybe more is impacted. Maybe school is impacted in the fall. So, like, what can we expect as time goes on? And what does it mean for our mental health?
I mean, honestly, right now, what we're seeing in the state of Maine is a lot of cancellations of traditional celebrations like the Lobster Fest and music festivals, all the summer activities that people are looking forward to. Rentals are being greatly impacted because Janet Mills, our current governor, is putting a 14-day restriction on anybody that's coming from out of town, which means, if you're coming to vacation, you have to plan to be here for 2 weeks, a 2-week quarantine. So a lot of people don't have that kind of vacation time. They can't really take off work for 2 weeks in a row. And then that greatly decreases what they can do in terms of activities. Can they go to the beaches? I know one of the beaches in southern Maine opened up this weekend, but it's only 2 Mainers. So a lot of the activities are being limited just to the state of Maine, residents. So that's pretty difficult. And as a state, we're considered the vacation land. So a lot of the income that Maine gets is from vacationers, lobstermen, seafood fishermen. A lot of the local farms really depend on vacationers to bring income into the state. And that's really going to harm us this summer. And that's creating a lot of stressors, especially on families, who depend on making ends meet during the summer so that they can survive their winters, especially the lobstermen and the clammers and the fishermen. You see a lot of teachers in the state resort to serving tables. Restaurants are big. My brother's a server. And so his concern is, well, what happens when, unemployment runs out, and the restaurant's not open, are my tips going to be enough for me to survive the summer? So there's a lot of what ifs, a lot of anxiety, a lot of paranoia about what to do next, and just the unknown, let alone the boredom. I mean, there is a lot of boredom. I am bored. I am so bored on the weekends. It's insane. I mean, there's only so much Netflix you can watch, and not to mention the weight gain that people are experiencing. You see those little memes on what is it, Facebook or Instagram, and people are joking about, accruing the COVID weight, and it's like, that's fact. There's a lot of, it's true. There's a lot of fatigue, a lot of,
it's crazy how, like, sitting around can make you so tired. Like, it's like, why am I so fatigued? Why do I need 10 hours of sleep now?
Yes. I mean, in a sense, we're living a sedentary life right now, which is not typical of human nature. Humans are, we're animals and we like to be out. We rely on sun to get our vitamin D. We rely on foods to provide other nutrients. And, a lot of this stuff is this pandemic is really taking a toll on everybody's routine up here. Definitely.
Yeah.
So it's like we have to be concerned about the effects of how our income might be impacted because of COVID-19, because might be okay for now, but as time goes on. So that's like a constant stressor that people carry, that worry about money. That's like a big one.
Absolutely. Especially when people's income is based on summer months. So, you know, and like I said, the lobstermen, the clammers, the fishermen, people that rely on income from May until maybe late September, it's really going to impact their family financially.
You know? So I'm going to throw you a question that I don't know. I haven't really heard this a lot of like advice on this. So I'm not sure how this will turn out, but like, what would you say to someone who is very worried about catching COVID-19? Like they're just, you know, maybe they're already a little bit of a not diagnosed hypochondriac, but they're a type of person, they wash their hands a lot and they try to avoid germs. What would you say to someone that's worried about catching it and worried about the fear of it? Yeah.
Well, it's kind of interesting. I was reading an article the other day that crisis calls to hotlines now are increased by 1,000%. So people are calling suicide hotlines 1,000% more than what they were previously. Wow. That's a huge jump. Yeah. Right? So, you know, people are really struggling as a result, and not knowing what's next for them. You know, it's kind of like Chicken Little, the sky is falling, the sky is falling, but the reality is the sky is falling. You know, it's not it's not necessarily a falsehood for some people. You know, and the best advice that we can give anybody is just take precaution. You know, do what you can. You can't avoid it 100%, but you can do your best to try. Washing your hands, wearing a mask, carrying sanitizer in your car, making sure that you're sanitizing diligently. Wear gloves to the grocery store. Wear gloves when you pump gas. Wear gloves when you open a door. Everything has to be
social isolation. Or
you really do have to be methodical about that, and really think about, you know, and remember not to touch your face with your gloves. You know, remember, I think it's really important to see how doctors take off gloves. You know, they start at the bottom, pull it off, and then pull the other one off with the other glove. There's a lot of online videos that you can watch on how to do that safely. Changing your gloves, washing your mask, changing disposable masks. You know, a lot of people are buying masks that can be washed. Well, it's a one and done kind of deal. You know, you go out for the day with your mask on, you come in and you either use a fresh new one and wash the old one, you know, or you wash the one you have and make sure you have it washed before you go out again. One of the other things that I started practicing, especially since being an essential employee and having to go to work every day, so when I come home, I change my clothes. I get out of my clothes. I don't lounge around in my house in the clothes that I wore outside all day long. Like, these are practices that, you know, as kids, you remember you'd come home and mom or dad or the babysitter would be like, go change into your play clothes. That's what you have to do. You have to change into a set of clothes that you did not wear anywhere outside of the house. I've also made a practice sometimes if I feel extra precautious, I take a shower when I come home. You know, those are things that you have to kind of implement in your life today.
How do we find a balance between, like, I take my shower when I go home, or I took a shower and now I'm taking like 3 showers because I'm like so nervous about it? Maybe that's a time where you should start to reach out to someone.
Well, yeah, you definitely
compulsive about these things.
You don't want to be too compulsive about it, but you definitely want to be mindful. I don't think it's unreasonable right now in our current situation, our current environment, to take 2 showers. Okay. You know, you can take a thorough shower in the morning and maybe you take a bird bath at night. You know, just enough to like rinse off your face, maybe rinse off your body a bit. You know, you don't have to do, you know, thorough cleaning. You also want to avoid baths, in my opinion. This is just my opinion. You know, a lot of times people think baths are cleaning themselves, but you're really just soaking in your own dirt.
I've heard this before.
It's true. Baths are relaxing. They're wonderful, but you're really just soaking in your own dirt.
Yeah.
Showers are more cleanly because the dirt is going down the drain where, it's not happening in the tub.
Right. That
But
makes
that's
sense.
just
Because
my
you don't want to
personal
soak
opinion.
in anything.
Right.
Maybe you could take your shower,
right,
run your bath, and then get in your bath, or
right.
like that.
And if you're out and about, say, it's the little things that you have to kind of remember. If you're out and about and your eye itches, well, you take your glove off, you go into the bathroom, you wash your hands, and then you rub your eye, fine. But you don't rub your eye with the glove. If you're out and about and you have to blow your nose, you go to the bathroom, you take your gloves off, and you blow your nose.
I just breathe through my mouth. I don't even blow my nose outside.
Right.
And I wear sunglasses so that I can't access my eye accidentally. Like, oh, my eye itch.
Well, some of us, Tia, suffer from postnasal drip. So
I do. I
all do.
I have all that. I do. I have I think it's called rhinitis. I can't remember because it's not that big of a deal, but it's just like your nose starts to run randomly.
Yeah.
It's very disgusting. Anyway.
Yeah.
It's not.
Yeah. But it's like the routine things.
So if I feel just like so if I have taken my showers and I use my hand sanitizer, I'm still sitting there and I'm nervous, maybe I should reach out to someone.
You can reach out to someone. First things first, I think it's always important to get educated by your primary care physician. Talk to your doctor. Call your doctor's office. Talk to somebody. Most doctors today have social workers, nurse practitioners, nurses that are prepared to discuss these things and to talk about what kinds of precautions you can take. Okay. I think that's first and foremost. I think always checking in with your primary care physician is important. Practicing some good coping skills is also important. Lots of times when people are anxious or nervous, one really good coping skill is chewing on ice. Because what ice does is it relaxes the back of your throat. Lots of times when people get anxious or anxiety or panic attacks, you ever feel that lump in your throat? You're like, what's that face to you?
I can't handle I can't. My teeth are too sensitive. The thought of chewing on ice is like very painful.
Well, even sipping on super, super cold water, like, water that you froze in and let it sort of thaw a little bit. And you know how the water's super cold. What it does is it relaxes your throat. And it calms you. So these are some things. You also might want to get like a fidget spinner, something that just keeps you, or a stress ball. Those are also helpful. But just keep in mind, there are mental health services that are available to people. You don't have to go in to get help. You can call. You can call your local therapist. You can call a hotline. Lots of times right now, especially in the state of Pennsylvania, I was reading on Psychology Today, and some of my constituents that I worked with previously, they're doing Zoom therapy. They passed it. The ASWB passed the allowance of Zoom. So now insurance providers are allowing people to do Zoom sessions, which has been helpful. And if you can't do a Zoom, maybe you do a phone session, and that's okay too, because not everybody has access to the internet. So there's lots of options out there. Psychology Today is a really good website to find a therapist as well. If you don't have one, you can also call your insurance company and they can elect one for you or give you a list of names of people in your local area.
Now, if I don't have insurance, what can I do?
So if you don't have insurance, you can go to a clinic. There are lots of clinics. There's clinics in every neighborhood. In each clinic, there is a LCSW. Hospitals and healthcare systems have adopted the new way of practicing where it's more holistic. They're treating people not just for their physical ailments, but they're also addressing mental health issues. So every clinic in every community has a licensed clinical social worker that will provide therapeutic services. and
Okay.
case management. So
Okay.
it's a pretty well-rounded system. It's kind of unique because of the healthcare change in Obamacare, where it's been really great. Everybody since Obamacare. It's funny because I worked for a grant-funded program, um, and our focus at one point was to get people insured. But we knew with Obamacare getting implemented that that was all going to go away, and it absolutely did. We didn't have one person in the community, unless they were struggling mental health wise, to
Mm-hmm.
sort of connect,
Mm-hmm.
that did not have insurance.
Mm-hmm.
Everybody was insured, and that was the blessing, in my
Mm-hmm.
opinion, of Obamacare.
Mm-hmm.
And so then the issue became, how do you, so one of the things that Obamacare did is it didn't allow providers to double dip. And what that means is a provider could only charge for the same diagnosis one time. They
Mm-hmm.
needed to fix it the first time or have a different diagnosis when the person came in, right?
Mm-hmm.
So that really cut out a lot of practitioners being able to um, overuse the system, if that
Mm-hmm.
makes sense.
Mm-hmm.
And I think it's helped quite a bit for people, especially people with comorbidities, because a lot of times they go into the doctors and not really understand what they were struggling with, and a lot of times it was undiagnosed mental health issues, right?
Mm-hmm.
But they'd come in for physical pain, right? Sometimes it would be
Mm-hmm.
somaticized, sometimes it would be addiction pain or withdrawal pain or whatever it might be. And so the doctor would prescribe them pills for it, right? But that didn't take away the pain. The
Right.
pain was a lot of times up here, right?
Mm-hmm.
And that issue was not being addressed. So what I think in some ways Obamacare did is it allowed or sort of steered clinicians into taking a deeper look at what else is going on with this patient, because I've treated them for this particular issue. This is the right course of medication. What else can I do for this person? And a lot of times it was just more about, are they depressed? Is there an undiagnosed bipolar or borderline personality disorder? Or, do they have anxiety disorders? What's going on with them? Do they
Mm-hmm.
have undiagnosed schizophrenia, which is, atypical, because schizophrenia is pretty,
Extreme. It's pretty,
yeah,
yeah.
straightforward.
Yeah.
um
Pretty
but
obvious.
you know a lot of people went untreated, and
Mm-hmm.
so once you start treating the mental illnesses, you see everything else starts to fall in
Mm-hmm.
place with them physically,
Well, this
right?
is a good tip for somebody that they find themselves constantly at the doctor, or that pain won't
Yes.
go away, or maybe, they should look into some mental health services.
Right, right. And a
Mm-hmm.
lot of times doctors were not necessarily referring to mental health disorders because that was so far out of their comfort zone or thought
Mm-hmm.
of process. Um, and so I think with how healthcare has changed, they have to address that now.
Mm-hmm.
You know, you see a lot of issues, especially with people who are living in psychiatric communities, I'll say. So people that live in group housing, right?
Mm-hmm.
They are assigned ACT teams. So people are actually coming out. It's a group of teams. It's a team. Usually it's a primary care physician. It's a primary counselor, like an LCSW or an LPC. It's a nurse. It's care aides, depending on what the need is. They will provide them their medications. It's lots of times it's supervised housing. It's also case management. So it's the whole shebang, right?
Mm-hmm.
And so with this whole COVID, I'm sure that particular area uh, suffered quite a bit.
Mm-hmm.
What are the people going to do? How are the ACT teams going to get to their
Yeah.
patients? Number one, are
Yeah.
their patients going to allow them into the house
Mm-hmm.
based on their own mental health issues? So there's all
Yeah.
these moving pieces to consider when it comes to mental illness.
So it kind of just reminds me of the whole thing that with this pandemic, we're all connected. I think for various reasons, we as a society have been led to believe that we're individuals first, and there's nothing that could really take that, away, or deprioritize that. But now we have this pandemic, where not only um is it our interactions or those of us making sure we're not interacting that's
Yeah.
going to help save each other? But there's also that piece of, okay, there are now a lot of people around me, my neighbors, my community, that might be going through elevated mental health issues because
Yeah.
of this. Or
Yeah.
you might not have known that your neighbor had someone
Yeah.
come in and help them with things until you see
Right.
them screaming at the person, telling them they can't come in now.
Right. Right.
So,
And think about some of the
yeah.
older folks that have care aides that come into their house to care for
Right.
them. What's happening in that area, and
Right.
how difficult is that for some of the older people who are aging in place?
Yeah.
You know, we see that with my grandma. You know, we had, although she lives with my dad, you know, we had an aide that was coming in every day, Monday through Friday,
Mhm.
to sit with her, you
Mhm.
know, for a few hours a day.
Yeah.
And that's no longer, you know, now it's up to dad, but you know, dad's retired and that's fine.
Mhm.
But not everybody has that luxury. Not
Right.
all aging in place people have family or friends that are there to sort of pick up the slack where care aides were taking care of them.
And
Right. Or
just
even people
Running
with
running for
disabilities.
what's that?
And even people with disabilities. Like
Yeah.
my cousin has MS, and
Yeah.
she has a home health aide
Right.
that has been unable to come in ever since the pandemic.
Mhm.
Right.
Well, granted,
And your
that's also another
cousin's more
cousin.
susceptible.
Right.
I
Yeah.
think like there's like that loneliness factor then,
Yeah.
because the aides come in and they do um those like really practical and apparent things like helping out around the house or maybe making meals and things like that,
Right.
but
Grocery shopping,
also,
picking up meds, all of that.
right,
Yep.
but they
Making
also
phone calls.
provide a level of companionship where
Yes,
you
they
know
do.
that
Yeah.
there's somebody coming every day.
Yep.
But
Yep.
now some folks don't have that.
Right. And think about some of the older adults that are aging in place that depend on their care aides to sort of fill their medicine planners, right? Because otherwise they get confused, you
Mhm.
know, and they take their medicines wrong. I mean,
Mhm.
it's something as simple as that for you or myself. It's a lot harder for
Yeah.
older adults to do. I can't even imagine, you know, grandma filling her own medication planner. She'd be high as a kite.
Probably would. That's funny.
She would be.
I want to double back to something you said earlier when you were talking about the young men and boys that you work with,
Mhm.
and how going out and being able to have privileges like that was a privilege, that's something that they earned.
Yep.
So it's like an incentive for good behavior. I'm just
Right.
thinking about parents who have, these tweens and teenagers that maybe that was also the incentive too. Like if you
Yeah.
keep your grades up or if you act right, you can go out with your friends on Friday nights. And now
Right.
they don't have that. So I guess like I guess I don't want
Well,
to go down the rabbit hole as far as what that means for parenting, but I guess more of like what kinds of things can people do to like keep just like kind of help their kids in their mental health. Like I'm
right.
thinking you probably had to do some stuff with the boys to try to keep them,
Oh yeah.
positive and
Yeah.
on
Yeah.
track. So like what are some of those things that you think you could share
Yeah.
that could apply
So
for
it's kind
others?
of interesting, and I've been thinking a lot about this. It's kind of the pandemic in some ways are it's either bringing families closer together where parents are having to step up into a new role where, you know, teachers in school would take certain roles and certain responsibilities off of the parents by teaching their kids. The parents are now having to step up
Mm.
and teach homeschool these kids in a lot of ways. Make sure that they're getting on their Zoom meetings, make sure that they're doing their homework that's assigned to them via the computer, and being with them a lot more than what they are typically with them. You
Mhm.
know, parents, you know, although we're at work, right, we still get about 8 to 9 hours kid free.
Yeah.
Right. And so being around your kids those 8 to 9 hours is is a new thing for a lot of families, for those who are not stay-at-home parents. So, you know, it's a whole nother kettle of fish, and it's going to be interesting to see what dynamics form as a result of that in parenting, right? Because parents are now having to be a little more creative, whether it's doing crafts. For those who are interactive, fine, you get a pass. Everybody knows that, right? There are some parents that are super involved and do those kinds of activities, but on average, can we say that that's the norm? I don't know that we can at this day and age, honestly. And it's not to say that parents are bad, but people's lives are pretty complicated, and
they have that
you know,
routine.
there's lots of
Their routine is
there's
not
a routine,
hours of
right?
activities with my child.
Right.
Yeah.
Right.
It's usually,
You know,
pick them up after school, feed them, make sure homework's done.
Yep.
Maybe watch a little TV together, you have time. If not,
Yep.
off to bed. So that's usually the routine. Yeah.
Right. And then they go to bed and the parents have their own time, right? Well, that's done.
Right.
That escape is not there right now for many parents who were used to having that. So there's a whole nother dynamic that's being introduced in this whole pandemic when you think about it. And it's going to be quite interesting to see how this plays out for families and what comes from it, if you ask me. And I think in a lot of ways it's good. It's a good teaching tool if used in that way. In some ways I can see it being very detrimental for some situations in some families that have a lot of dysfunction. You know, so it's good and bad when you think about it. But parents do have to be more creative. I mean, you can still take your kids out for hikes. You can still do crafts with them and have movie nights, and you can teach them some life skills like cooking, you know, letting them help you cook, set the table, make the bed. There's an opportunity here, in my opinion, to instill a routine with your kids that you may not have had time to do before. You know, like, yeah, some parents will get up and say, all right, make your bed, pick up your room before you head off to school. But the reality is people are running on a time, you know, on a time schedule. Lots of people don't leave themselves time for breakfast or to get their kids to school on time. And now you have this opportunity here to learn a different routine. And I would take advantage of it. You know, schedule your life as it is in home. You know, make sure you're waking up at a certain time. Make sure that the kids maybe pick up their toys and stuff. Maybe they do it before bed. Maybe they do it in the morning. Maybe they make their beds, brush their teeth. Maybe they help you cook breakfast in the morning or grab some cereal. It's a good opportunity for you to sit down and have some cereal or pancakes or whatever. I mean, there's a lot of opportunity in this, as difficult as it might be. So I would take advantage of it.
Is that routine? Is that like helpful for kids? Like, is that helpful?
Oh yeah.
For the
Kids thrive on structure, routine, consistency. They need that. They need that. If they don't have that, it creates insecurity in their life. 100%. It creates either it will create a stronger unhealthy attachment, or in some ways it can create a distant attachment. So it can go either way. So I think it's a really good opportunity for a new routine to be built, and take advantage of what the COVID is doing to our society. I mean, there's positive ways of looking at this when you think about it.
Right. Well, so I do have a question it's kind of related to this, I guess, conversation we were just having, and that is, like, I know with all the cancellations of schools and things like that, there are a lot of milestones that this generation of students are going to miss. You know, proms, graduations, move-up days. So, how would you suggest parents help their kids through those frustrations and disappointments? And I guess it's even a broader issue because it's not even just kids who are dealing with it. Like, I have a cousin who was supposed to have his 60th birthday party coming up pretty soon. That's gotten pushed back. We had a vacation that had been planned. That's gotten pushed back. You know, kids who were looking forward to going away to college for the first time now are still back in their parents' houses. So what kinds of strategies would you suggest for helping someone deal with disappointment as a result of all the cancellations and changes that are occurring right now?
Yeah, and it's interesting because it's summertime, it's time of weddings, right? And how many
Right.
people's
Mhm.
weddings are now being canceled?
In June.
And again,
Mhm.
it doesn't have to be exactly the way you want it, but you can make something of it. I'm an optimist. You see people now, there's a trend of getting married online, and everybody's
Mhm.
sort of zooming into the wedding, or you're
Mhm.
taking the opportunity to have a private ceremony, and then when things clear, then you have like a family celebration. I mean,
Mhm.
there's all sorts of opportunity here. Yes, it sucks that, you're not going to be able to traditionally walk down the aisle, grab your diploma, wear your cap and gown, celebrate with your friends and family that night, and do whatever else. But what can you do? You can celebrate in your home.
Mhm.
You can start a new tradition. This is an opportunity, again, learning how to build a new routine. It's also about learning how to build new traditions in your life, and learning to adjust to the ups and downs that life gives us.
Mhm.
I mean, that's really the bottom line, is learning how to weather this storm. As humans, I think a lot of times we forget that we have to learn how to adjust to our circumstance. But we're capable, we're adaptable, right? And
Mhm.
so there's a lot of opportunity to be creative and innovative. And you have a private little graduation party, or maybe, you dress up and you have a prom in the house with dad and mom, and your siblings. There's lots of
Mhm.
opportunity. Or maybe you plan for something later on down the road once, the COVID starts to die down. Maybe it's a good opportunity to plan for a party,
Mhm.
something fun. But there's always opportunity to make the most of the situations, and that's just life. you know and I think, in a lot of ways, you can see how much we have taken for granted as
Yes,
Yeah.
humans.
definitely. Yes.
The luxuries that we have.
Mhm.
In a lot of countries, they don't have graduations like that. They don't have proms. They don't have the kinds of things. So, we're kind of starting to
Mhm.
experience in some ways what others have never experienced as well.
Mhm.
And what do we do with that? And, just like them, we
Mhm.
adapt and we make the most of it,
Mhm.
Mhm.
you know?
Right. Well, I also have, I guess it's not quite a follow-up question, but it's still related. So, as a result of the pandemic, we're all obviously home a lot more, which means that we're watching a lot more television and
Yeah.
consuming a lot more media and a lot more news.
Yeah.
Mm.
So sometimes the news can be depressing and overwhelming.
Yep.
How do you suggest building, like, I guess, appropriate boundaries as far as what type of media we're willing to
Mm.
consume at the time, or
Mhm.
how much media we're willing to consume at the time?
Right.
Because, like, I know
So,
early on, it's like there's the temptation to watch every press conference, and then it's like,
right.
okay, I can't sleep.
Right. And it does create a lot of stress. That's one of the things. My dad's pretty old school, and he is big on watching MSNBC, but he watches it over and over again. It's the
Yeah.
same stuff. It just
Yeah.
sort of replays itself. And I'm like, you just saw that.
Yeah,
You
my
just
mom's the same
watched that.
way. You
Nothing's
go to my mom's
changed
house,
since
CNN all day.
Yeah.
all day
That's
long, and it's not
it. Yeah.
healthy. It really can change how somebody perceives life, perceives themselves, perceives others.
Mhm.
It can really create negativity in your life. I don't watch the news. I read it. I will read the news, because there's
Mhm.
a different tone when you read versus when you hear, right?
Mhm.
So I think it's important, the important things like watching the weather. If you're interested in politics, read some information about politics. If you're interested in the business, read about business. If you're interested in environment, read about the environment section. But don't
Mhm.
overdo it.
Right.
Don't spend
Right.
hours upon hours all night watching the same broadcasts over
Mhm.
and over. It's just not healthy. It's not
I think
healthy.
like channels like CNN, Fox News, MSNBC, those like news channels, the way that it's produced is almost like entertainment. So like
Yeah,
it's produced in a way to really draw you in and get you to keep watching all
sure.
day long.
Sure.
Even though they're telling you the same stuff. It's just,
Right.
the animations and the
Right.
music and the
Right.
lights and the
Right.
people and
Right.
how
Like
they do it. It almost feels like, like it feels like
it
entertainment.
is. It's like
Yeah,
the
it
same
is.
breaking news every 15 minutes.
Right.
Like same
So it's
exact news every 15 minutes with a big breaking news logo.
Yeah. Yeah.
where
It's
you
the
kind
same
of can get
story with a
sucked
different
in and
spin
not
on it.
even realize I keep hearing the same thing or the same negativity over and over and
Yeah.
over again.
Yeah.
Yeah.
Same story, different spin,
Mhm.
different perspective. And it's like that can be very damaging to the brain. It
Mhm.
really can be damaging to how we think, how we
Yeah.
feel. Think about, a good exercise would be to be mindful, right? Say
Mhm.
you're in your room and you're laying down and you play different types of music. You could play something soothing, you can play something upbeat, you can play some heavy metal, and you can sort of experiment by seeing what your mood is, how your mood
Mhm.
changes as a result to those different tones
Mhm.
and feelings that come up. And it's a good way to kind of think about social media. You're getting the same message, it's being shared by a different perspective, but the message is still somewhat negative,
Mhm.
Yeah.
and stressful. And
Mhm.
it's every outlet, every media outlet, whether it's Fox, MSNBC, and it doesn't really matter what your politics are. It's
Right.
really that negative undertone of fighting, right? It
Yeah.
gets
Yeah.
your
Yes.
fight or
It's
flight
true.
in
Yes.
overload. And right now during this pandemic, everybody's fight or flight is on and not shutting off.
I
So
agree.
adding social media aspects to that is really increasing the stress levels, and hypertension in your body and all sorts of
Mhm.
stuff.
Yeah.
Mhm.
And well, and speaking of social media, this has been a conversation that we've been having between the two of us a lot, where because of the social distancing, like social media has taken on a larger role in our lives.
Yeah.
And then you realize there's some people that you might be connected to on social media that you might not like.
Yep.
You know, one of them, you get it. It's just because like maybe it's easier to excuse certain things when you see people on a regular basis, but when all you have of that person is your social media presence, that
Yeah.
can be annoying or can be jarring. So I guess what kind of advice do you have for appropriate social media boundaries during this time period? Because I know we want to stay connected.
Yeah.
It's human nature to be connected. The technology makes it easy for us to be connected, but
Right.
Mhm.
sometimes we find out things we just don't want to know.
Right. I mean, think
Right.
about it. I was flipping through Facebook the other day, and I'm just seeing death after death after death,
Mhm.
whether it was you know, Jerry Stiller who passed away, or little Richard passed
Mhm.
away, and it's like, God, it's almost like Facebook's become the bearer of bad news, right?
Right.
Mhm.
And it's
Mhm.
like very depressing. So I've actually started to sort of not be on it so much. Like, I don't
Mhm.
know if you've noticed, Tia, I haven't been posting much.
I
I
don't
really
know. You still
haven't.
tag me when you're on there, so.
Yeah, well, I tag you when I'm on there, but I haven't been on there as much,
Mhm.
right? So
Mhm.
I'm really starting to sort of step back from that because I notice, like, God, I feel so negative like all the time. I
Mhm.
feel
Yeah.
like there's again, the sky is always falling, and I want to
Mhm.
hear something good. I want to hear something positive. And so you really should put a boundary or a limit on your social media usage.
Mhm.
Right.
It's superficial. It's not real connection. Yes, you can chat with your friends on Messenger, but I'm
Mhm.
talking about, looking at the advertisements, looking at
Mhm.
people's posts, whether positive or negative.
Mhm.
That stuff is kind of
Mhm.
superficial in a lot of ways. It's only a
Mhm.
piece or a smidge of someone's life. It's a
Mhm.
snapshot, right?
And I think
And
every fifth post you see on Facebook is an ad.
Pretty much.
right,
I'm pretty sure
right.
that's the algorithm or whatever. It's like every fifth post is an ad.
Right, but
So.
then think about the tones. What are people posting? Like half the
Mhm.
time people are posting their woes,
That's
right?
true.
Mhm.
They're
Mhm.
posting negative things that are happening in their life, and then you
Mhm.
see a few positive things sprinkled in there, but it's like,
Mhm.
do I really want to spend my time looking at that crap? I go to work
Mhm.
every day and work with kids that have severe trauma. I don't want to
Mhm.
read about it.
Right.
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 Right. Or then you
That
end up
makes sense.
finding that somebody you thought was a friend holds some crazy views.
Right.
which would be even more
That's
disappointing
stressful
if not.
too. That's very stressful when I see and that's another reason why I sort of backed off is that I noticed that I was having like a physiological response
Yes.
Yeah.
to what
Yes.
some people were posting. And I thought to myself, you're healthcare workers. How can you think like that? And then I
Mhm.
went down the rabbit hole of thinking like, well, if you're thinking like that, how are you servicing your patients? Does
Mhm.
that thought process
Mhm.
influence how you service people?
Mhm.
And then I'm thinking, oh, well, of course it does. And then I put my social work cap on and it's the weekend and I'm like, no, my social work cap is off. I'm
Yeah.
Chris right now. I'm not Chris the therapist. I'm not Chris the case manager. I'm not Chris, the person that's going to, do this or that for you. I need a break,
Mhm.
and I just realized I need to just back away from it,
Yeah.
you know?
Yeah, I definitely can relate to the putting up boundaries with
Right.
folks.
Yeah,
Yeah.
Definitely.
I've been
it
snoozing a
really
lot of people
does
lately.
get you upset. What's
Mhm.
that? What's
I said
that,
I've been
Spencer?
snoozing a lot of people lately.
Yeah.
So not completely unfriending or unfollowing them, but hiding them for 30 days at a time.
Right, and you're angry, right? It triggers your own anxiety, your
Yeah.
anger, your
Yeah.
frustration, and then you're just like you're holding that inside, and it's like for
Yes.
what? You
Right.
probably
Yeah.
haven't talked to this person in how many years?
Right. Right.
Right.
And I agree, like with what you were saying about, especially when they're healthcare professionals. Because for me, if they're pastors, I'm like, oh
Right?
no, you're teaching your congregation this.
Mhm.
Like
Yeah,
you're teaching them
right,
conspiracy
Mhm.
theories. What are you doing? And then
right.
it becomes like, I need to hide this person
Well,
before.
it's funny. That's not the snapshot you would get of that person prior to social media,
Right.
right?
Right.
You would know them differently,
Yeah.
right?
I almost feel like social media has helped make some conspiracy theorists and things because at least before social media and YouTube, information was vetted in some way. And yes, it may have leaned towards, just for example, conservative thinking or liberal thinking based on who it went through. But I'm going to say, even the more often than not, at least the information shared at its base level was true.
Right.
But now that you have YouTube and you have Facebook and you have just all these ways for
Yeah.
people to make up any story that they want and share it with a large amount of people very quickly, and especially in a time where um there is so much that we don't know and there's confusion and there's worry and people want answers.
Hmm.
So in their search for answers, you can almost find anything on social media that will back up the answer that you want.
It's true.
Yeah.
So it's almost like it's helped create this false
Right.
information and conspiracy theorist, if you will.
Right.
And how many people do you know use social media as their news source?
A
Yeah.
lot.
It's
Oh my
Yeah.
gosh.
It,
Yeah.
insane. It's
right. It is.
Yeah.
And I say,
insane.
especially older people,
Yeah.
like what I find is that, my mom is pretty tech savvy, but every now and then I have to like bring up, like, that's not a real news source.
Yes.
Yeah,
Like, or like YouTube. I'm like, anybody can put a video on YouTube. Like, I
exactly.
can put a video of myself staring at my belly button on YouTube,
Yeah.
and that does not make it news. Yes, maybe if like it's a video made by, abc.com or something, then
Yeah.
maybe yes, it's from a reliable source. But
Yeah.
just because it's on YouTube doesn't mean that it is correct, vetted information.
Right.
Right. Exactly.
But then the other thing I was going to add in about social media, which I think you were getting at earlier, is that I don't know if these like conspiracy theories or the crazy things people are saying are new as much as they're things that would have stayed private prior to social media. Like
Exactly.
some people just don't have a filter anymore.
Right.
Or like just don't think that the words that they put out on social media can have consequences, as we've seen through the number of people who say dumb things and get fired.
Yep.
And you're like, wow, I didn't know that was going to happen. Like you put your name and your real picture next to some racist
Right.
stuff, and then you are surprised that they were able to find your job and get you fired.
Exactly. it's a whole new side that we're seeing to
Mhm.
people that we wouldn't have seen otherwise.
Yeah.
Like a lot of the people that post some of the things that they do, my thought is, what happened to them? Well,
Right.
nothing happened to them. They're the same people. You just didn't hear it because there wasn't an outlet for it.
Yeah.
And it wasn't
Mhm.
socially acceptable to talk about it either in your presence
Mhm.
or in the environment that you were in. And
Mhm.
so you're seeing a whole new side to people that you just never
Mhm.
really knew.
Yeah.
And it's kind
Right.
of interesting. I don't know if it's good or bad. Um, it's kind of hard to say, but for me, it's kind of felt bad in a lot of ways because I'm like, wow,
Mm.
wow,
Yeah.
really?
Right.
Yeah.
Yeah. I feel
That's
like it's
your
a
thought
mixed bag.
process?
Yeah.
It's like a mixed bag because on one hand, I'm happy to know what people around me actually think, because then
Mhm.
it helps me not to waste time with those relationships.
Especially our less melanated friends.
But
If
Hmm.
you
then, but
will.
then on the other hand, it feels kind of painful when you realize how pervasive those perspectives are.
Yeah.
It's
Yeah.
like, wow,
Yeah.
it's like you too.
Yeah.
Yeah.
Or it's
Yeah.
like I knew about you over here, but I didn't expect this
Yeah.
from all of you.
It's a
Mhm.
vicious cycle, isn't it? It's
Mhm.
Yeah.
like, I was looking on Facebook and I just get shocked at how many of my female friends are supporters of Trump. And my views about
Mhm.
Trump.
Yeah.
And, it's just so
What the
shocking.
53% of what was it? 53% of white women voted for Trump.
Yeah.
So
It's insane to me.
more likely than not.
It's
Like you look at
insane.
your white friends and your like white female friends, especially for me having gone to, my undergraduate was at Bryn Mawr and it's a
Yeah,
predominantly white female undergrad institution.
right.
So it's like, the
Yeah.
statistics tell me it is more likely than not that each of you voted for
Right.
Trump.
It's disheartening, right?
Yeah.
No.
Right, because yeah, because I experienced the same thing. Well, not as far as women, but just in general. Like having grown up in Northeast Philadelphia, which was predominantly white and lower middle class. Like a lot of my elementary and middle school classmates are all like pro Trump this, Trump that, Trump
Yeah,
this, send Mexicans back, you know.
yeah,
And
Yeah.
it's just like, wow. On one hand, I'm thinking, what happened to you? But on the other hand, like, no, I know where you're from. I actually know why you're the way you are.
yeah.
Yeah.
It's shocking. It's like, what happened?
Yeah.
Yeah,
It's almost like, well, I don't want to get too deep down the rabbit hole, but
Right.
it is almost like, a lot of the more things change, the more they stay the same. People
yeah,
still have those attitudes about others.
yeah,
Yeah.
So I want us to leave on a positive note. And you mentioned a few things. You mentioned like making sure you have a routine. You mentioned, getting yourself, maybe a fidget spinner or a stress ball or just some way to let go of anxiety.
yeah.
You talked about um going and listening to music and just like reflecting on your mood.
Mm-hmm.
There's some other tips that you could give folks for how they can just be keeping their mental health
Yeah,
as well as possible during this time.
yeah. Do some indoor exercise videos. Those are also super helpful. Even maybe doing some yoga inside. You can always, on a nice day, put on a mask, go on a hike.
Mhm.
Nature is our friend. That's important. Take a walk, even if it's up your street and back.
Mhm.
You can put on a mask for that. Um, you know, there are plenty of hotlines that you can reach out to. I think it's important for you to be self-informed. If you have questions about COVID, don't listen to strictly what's on social media or on the news outlets. You have to call your primary care physician. Get informed
Mhm.
via a doctor. There's
Mhm.
lots of options there. If you need support for mental health services, again, you can call a hotline. You can call your primary care physician, who 9 times out of 10 will have a social worker connected to their practice, especially if they are under a hospital hub.
Mhm.
If they're a private practice,
Mhm.
then you can either go to your local clinic, you can call your insurance company to get assigned a therapist.
Mhm.
And one thing to keep in mind when you're looking for individual therapy, not everybody's a fit, and that's okay.
Mhm.
And I know it's very,
Mhm.
very stressful, especially when you are in the depths of despair, right? And you're
Mhm.
at your wits' end and you just need some support. Um, it's still important to test people out.
Mhm.
You have to connect to that therapist.
Yes.
If you don't, it's so advisable to find somebody new, because you will find
Yes.
somebody that will fit your need. But don't
Yes.
give up just because the first one doesn't work. It doesn't mean
Mhm.
therapy doesn't work. It just means that person wasn't right for you,
Mhm.
right?
That's so true. I
That's
wish
true.
I could even give my past self, my younger self, that type of advice.
Yeah,
Because I had quit therapy a few times just because people weren't a fit, and then I didn't go back for years.
right.
But really, it's about, you have to find someone that's a fit, because you have to find someone that you're comfortable with
Yeah,
Right.
telling things that you don't tell to anybody
right,
else. But
right,
uh for a therapeutic reason, for a reason to
yeah,
help talk about why those things affect you, how you can get them off your chest and not feel the shame and weight of them. So it
right.
has to be somebody that you click with, that you trust.
Right.
Yep. So psychotherapist.com is a great website to find a therapist in your local area.
Mm-hmm.
Lots of therapists today are doing Zoom or phone sessions. So
Mm-hmm.
there's not a reason to not get connected.
Mm-hmm.
Again, lots of communities have clinics, and inside clinics, they offer case management, mental health services, ACT services, all sorts of things. So the system is still there. It's still working for people. They've made adjustments. They've adapted to the pandemic, but they definitely are available.
Okay.
Okay.
Well, this has been great. Thank you so much for this conversation.
Yeah.
And I would tell people to check out your Facebook, but you ain't gonna be there. So
Ah.
oh well. But actually, if you have enjoyed this conversation, make sure you like and comment on it, and just let us know, because there's an opportunity to bring Kristina back, and maybe we can have a discussion and like question and answer type
Yeah.
thing.
Yeah.
So
Yeah. Do a live discussion.
yeah, like we could do a live discussion. So if you're really liking feeling what we talked about and want to explore any of that and more, just give us a comment. So
Yeah. Contact us on our social media. You can find us on Facebook, Twitter, at NYBF Podcast.
mm-hmm.
We're also on Instagram at NYBF Podcast, our website, nybfpodcast.com. And you can still find our episodes on most podcast aggregators, and after today on YouTube as well. Well, every now and then for special episodes like this one.
Yes. So once again, thank you,
Thank you,
Kristina.
Kristina.
Thank you,
And
guys.
for the Not Your Black Friends podcast, I'm Tia.
And I'm Spencer.
Bye.
Bye.
Bye.